I'd like to call the Health and Human Services Committee meeting to order. Madam Clerk, would you please call the roll?
Alderwoman Green. Alderman Gunther.
Here.
Alderwoman Martin.
Here.
Alderwoman Middlebrook.
Here.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Ingracia.
Present.
6 present, you have quorum.
Thank you. The first thing we will do is approve the minutes from the last meeting of the Health and Human Services Committee, which was on February 3rd, 2022. There should be a copy of those minutes in your Google Drive, and I would entertain a motion to approve those today.
I'll move to approve the minutes from February 3rd, 2022.
Second.
Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Aye.
Alderwoman Martin.
Aye.
Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingracia.
Aye.
Alderwoman Green.
Aye.
7 aye votes.
By your vote, you have sustained the motion to approve the minutes from our last Health and Human Services Committee meeting. We're going to move the agenda around a little bit today and start with committee discussions. Item number 6, we have our Health Director, Mati Fadzda Shlashwayo Davis, with us to talk about the mask mandates. I think it's especially timely. I think most of you probably read that the CDC made changes to the mask mandates on Friday. And so just Dr. Mati, if you could let us know what those changes are, how they're impacting what you're looking at in terms of data and metrics to make calls on what's happening here in the city of St. Louis. And then if you would be so kind as to take questions from the committee.
I apologize, I'm on mute. Thank you so much for the invitation, Chairwoman and Alderwoman Ingracia, and I'm happy to oblige. I'll be sharing slides and we'll then take questions at the end. This has been a challenging time, I'm not gonna lie. It's been challenging to be a rookie director coming into this phase of the pandemic. It's definitely been challenging for the staff who have been sort of weathering the storm since the beginning, with not as much by way of resources as they should have, but such is the nature of public health in the United States, unfortunately, and that's something that needs to be addressed in the long term. So we had already been working on our own recommendations, and as you can imagine, things got turned into a tailspin on Friday when the CDC then also adjusted their metrics. So overall, I'm going to ask that you bear with us and my team because they're obviously reacting in real time. And so we got these when you got these. And unlike the public, it's our responsibility to really take a deep dive into the data that supports these types of changes, and then take a deep dive into how those changes, will impact and should impact our city. And so if you learned anything about me, as much as I know that people want answers now, I don't provide answers now because then I wouldn't be doing my job. So the health department staff and our epidemiologists and communicable disease team are working overtime right now to make those adjustments. But I am able to share some insight into where we are, what the news on Friday means, and what's likely ahead. So, the first question is why refocus our efforts for monitoring COVID-19 in communities? So what you're seeing here is a shift from eliminating SARS-CoV-2 transmission towards what the CDC believes to be more relevant metrics, given current levels of population, immunity, and tools available. The reasoning behind this is that there's currently really high levels of population immunity compared to where we were previously in the pandemic, that then reduce the risk of severe outcomes. Those includes higher rate of vaccination in the population as a whole, availability of booster and booster coverage among populations at high risk, and an unvaccinated high rates of infection-induced protection. So I'm going to go ahead, you guys know me now, very transparent, and tell you my concerns for each one of these. We can say high rates of vaccination in the population, but we're not at herd immunity. So it's always going to be a concern of mine for us to try to act like we are when we're not. And in the city of St. Louis, we're at just over 60%. We're not at herd immunity. Those numbers take a deeper dive when you look at boosters. While boosters are available, only a quarter of our community is currently boosted. That is of even greater concern when you think about the fact that the Omicron variant, from when you ask which tool is most effective in protecting against it, and it accounts for more than 98% of our current infections, it's boosted, right? So if we have less than a quarter of our population boosted, that's a problem. And then we talk about high rates of infection-induced protection. We know that infection-induced protection is not as strong as vaccinated protection. So while those points have been made, and I understand them to be that, I think this is where you need to take a really closer look at what's happening in your local city. So the breadth of tools available for public health and clinical care have also expanded, right? We have broader access to vaccines, therapeutics, and testing. So let's pause here, right? So broad access to vaccines, sure, but in marginalized and minoritized communities, we know access continues to be an issue. And seen in the past, when we move quickly towards less community-driven mitigation strategies to individual ones, that the people that suffer the most are the people that are most vulnerable. And so our concern here is that disparities could increase if we do not pay attention to that. Therapeutics, while on paper they're available, we can tell you that we have very limited supply. We're talking in the number of 100 individual doses, right, available for some of the oral vaccines at any given hospital at a time. And that number drops significantly when you start looking at smaller healthcare settings. That's not nearly enough, right? And for testing, while we have ramped up testing availability in the city, we know that antigen testing is not equitably and easily available to everyone. And we should have initiatives in place for places like schools, for example, to be able to just test everybody weekly. That just doesn't exist. So again, while on paper, this makes sense and probably makes sense for cities who have 5 times our budget and healthcare departments that have more capacity, I think we have to take a deeper dive into what this means for the city. So community measures should focus on minimizing the impact of severe COVID-19 illness on health and society. That means preventing medically significant illness, minimizing the burden on the healthcare system, and protecting the most vulnerable through vaccines, therapeutics, and COVID-19 prevention. That's what it takes to take us from the definition of pandemic to endemic. And so at any given point, we need to be seeing, how are we doing with the parameters that are in this blue box here? So if you start looking at St. Louis from a community level, we're in a way better place than we were during the surge, right? Transmission levels in the city of St. Louis have drastically improved since the height of the Omicron wave in mid-January. Currently, we're averaging fewer than 20 cases per day, down from a peak of 517 on January 8th. And the PCR, the percent of diagnostic tests returning positive is below 5%, which is the threshold that the WHO has provided us. It's only been below that threshold for a week, but it still is. And that's very, very reassuring. So where I would say, let's be cautious in getting too ahead of ourselves is, number one, when you talk about the percent of diagnostic tests returning, that definition depends on people actually going to get tested. So I asked for all of our testing facilities to provide us with how many tests that they're actually administering, and those numbers have dropped dramatically. So we could be seeing some of that being influenced by the fact that people are A, not going to get tested as much, and B, maybe using at-home antigen tests for which we do not have any sort of reporting capability, right? So you can have a false sense of security there. The rate of vaccination continues to improve, with 70.1% of residents receiving at least one dose. But like I said, we're just above 60% at that 61.5% who have completed the series. Given this context of decreasing risk, restrictions such as mask mandates may be rolled back in the future for a return to more normal activities, with the understanding, and this is where I must be abundantly clear, that they may be reinstated in the future if community levels elevate to high risk as defined by the CDC. So let's look at how the CDC has rolled this out. So this is the CDC's COVID-19 community levels and indicators. They have the new parameters on the left, new cases, and this is defined as per 100,000 population in the last 7 days, looking at low, medium, and high. So if you have fewer than 200, and that's looking at new COVID admissions per 100,000 population over a 7-day total, and percent of staffed inpatient beds occupied by COVID-19 patients also over 7-day average. Or if you have 200 or more, and again, the same parameters, they give you which risk category you fall into. So low being less than 10%, medium being 10 to 19.9 on the first categorization, or high above 20. And then depending on where you fall with the new cases and the adjoining indicator, those numbers change slightly, right? So the community level is determined by the higher of the inpatient beds and new admission indicators based on the current level of new cases per 100,000 population in the last 7 days. And more information is provided at the link there. Hold on one second, I just want to look something up. Just bear with me 1 second. So to try to simplify this for you, how I'd like to describe this, and I just want to thank Matt Haslam, who worked tirelessly this weekend with David, within our epidemiology bureau, is new hospital admissions and the percent of staffed inpatient beds occupied by COVID-19 patients are the indicators that they're leaning more heavily into, right? With threshold based on the number of the cases per 100,000 in the 7-day period. So these indicators will give us a better sense of how strained the local healthcare system is, and can then inform policies like whether to implement a mask mandate. The CDC suggests that interventions be implemented when the community indicator is in the high risk category. So you have to be in that orange zone for them to then say that you are within the zone for re-implementing mask mandates. So here we look at St. Louis City specific metrics. So the City of St. Louis's COVID-19 dashboard, moving forward, what the team is working on is to update this to reflect the new metrics to keep the public informed on these key indicators. The data for these metrics are readily available to DOH. So for hospitalizations, the state's dashboard pictured on the left details the number of new admissions in the St. Louis region and the percent of inpatients who are COVID-19 patients. The data is not specific to just St. Louis City, but is representative of the region's hospital capacity. The St. Louis Pandemic Task Force publishes data in a similar fashion, tracking hospitalizations across the major healthcare systems, regardless of jurisdiction. So what we will be likely moving towards is, the city's mask mandate is currently active and may be allowed to expire on March 6th, giving the decreasing level of community risk as long as these numbers are upheld. The Department of Health needs to adopt the CDC metric thresholds for community risk level, and policymakers should consider reimposing prevention measures if community levels exceed the high risk thresholds outlined by the CDC. Where I stand very firm, and many leaders, I've been talking to the county about this and other leaders across the country, And we still believe very strongly that masking is an important and effective tool to prevent the vulnerable. And for us at DOH, we continue to recommend masking indoors, given. So that recommendation will stay in place with or without the support of a mask mandate, especially when in indoors or in crowded places. And here's why. 39% of city residents are not fully vaccinated as of February 26th. Parents of very young children have bombarded me with emails over the weekend. I can't even get to regular business because I am wading through emails from parents and from immunocompromised folks who absolutely feel like they're being left behind here. Very young children aged 0 to 4 are not eligible for vaccine, and most of them can't even mask if they want to, right? So what protections are there? And public health, by definition, is about community prevention, right? It is not responsible while we are still in a pandemic, whether or not we think we're shifting to endemic, while we're in it, to abolish all community protections, right? Especially for the most vulnerable. And most importantly, if you read the recommendations by the CDC this weekend, there is 24 conditions listed as high risk for which the recommendation is speak to your healthcare provider. I want you to think about that. If any of you today needed to talk to your healthcare provider, could you just pick up the phone and talk to them? How long would it take you to even get an appointment? And we are privileged. So now let's extrapolate that to the poor and those who don't have those protections. So people at risk for severe disease live and work in our community. These are people with diabetes, cancer, heart disease, immunocompromised, and others. I challenge you to go to that CDC recommendation and read the list of those 24 at-risk conditions. And then ask yourself, what percentage of the population do you think that comprises? Me and my colleagues think easily above 65% to 70% of the population. And so if the recommendation is call a health care provider, I, as your director, do not feel comfortable saying and not recommending masking indoors. And I think where our job is, and the difficult position that local health departments have been put in since this has been released, is on working to make sure that we are supporting different entities, our schools. I mean, I can't even tell you how many emails we've been bombarded with from individual schools who have no idea how to operate given what's happened, right? Our congregate living facilities, again, the immunocompromised and parents of young children. So we need to now be working around the clock to work with them as to how they're supposed to implement this, oversee this, and again, protect the most vulnerable. And quite frankly, that's the lens that we should always operate with. And for as long as I hold this position, anytime something new comes in, I don't think about it from the sense of the privileged, those of us who are fortunate enough to be healthy and to have access to basic needs. I always think about how this is going to influence the most vulnerable and then work from that perspective. So I'll stop now and I'll take any questions.
Thanks so much, Dr. Mahdi. I think all of us appreciate how thoughtful and methodical and based in logic and data all of your decisions are. And I know that is not always an easy position to take in a world where a lot of us would like to just return to life as normal. So with that, I will open it up to questions from the committee. Alderwoman Green.
Thank you, Madam Chairwoman, and thank you, Dr. Mahdi, for being here today. And that presentation was really great and informative. I guess the only question I have is, so as we are communicating this to constituents, it seems to me sort of the differentiation that is occurring here is if we are dropping a mask mandate, a mandate would be, this is what you have to do, versus if we're having mask recommendations, it is not what you have to do, but this is what we are strongly advising you to do based upon, data and science and metrics. Is that the way that you would advise us to communicate that?
Okay, I'm rolling with the punches here, right? Like, sure, I mean, all I can tell you is I strongly recommend that people should still be masking indoors based on this data and based on where we are. But what has happened at a national level, right, is we have been given these new metrics and told that unless you are in the orange zone, you should not have mandates in place. So we are moving to educate the public as much as we can. But what you will hear from the Director of Health for as long as it needs to be to ensure that the most vulnerable are protected adequately and that they don't comprise the vast majority of people in society by the different definitions I gave you, is that masking indoors should continue. Now, for folks, that's going to look different though, right? And this is where it's going to get difficult. I think what has happened here is the conversation is longer and more nuanced. I love simple messaging. Oh God, I wish I had been empowered to keep this simple, but it's not simple anymore, right? I live in a household with a husband who works with immunocompromised premature babies as a NICU pediatrician. I have one child who is 1.5 years old. My decision as to whether to follow that strong recommendation to mask indoors may look different from a family where everyone is vaxxed and boosted, everyone has no healthcare risks comorbidities that put them at risk. Those folks may feel more comfortable being unmasked, right? And one of the things that I also have to prepare the city for is this idea of stigma. There's a lot of people at grocery stores and in public places shaming other people, getting into fights on both sides of the aisle. Why are you wearing a mask? You look stupid. Why aren't you wearing a mask? You're irresponsible. That has to end, right? We didn't ask for this environment. We didn't ask to be almost 3 years into a pandemic. We are shifting these metrics and working with them in concert with our local city metrics. And what's happening realistically is that there's going to be different positions. I will tell you this. I was giving a talk on Friday and someone made a comment to me because, you know, the recommendations dropped as I was giving this talk, right? And they said to me, please be mindful of how stigmatizing and this whole scarlet letter, right, term that's running around with people masking and how that influences communities that are already suffer from these disparities and the positions that it puts them in. So it's just a difficult question. I don't have an easy answer for you. Yes, I'll probably have to shift from mandated to strongly recommend. The onus there is then on the individual, and individual families and maybe making different decisions based on the risk threshold in their households. And then we have to support those for whom that can become even more stigmatizing.
Okay. And then I guess question in terms of action from the Board of Aldermen, if it were a mandate, we would have to be passing a resolution to put that mandate or keep that mandate in place. If it is a recommendation, should we still for resolution, you know, stating that the position of the Board of Aldermen is that we are recommending masking to continue in these environments or these places, even if it's not a mandate?
I would appreciate any support from the Board of Aldermen once you've had a chance to look at the formal recommendation of the Health Department. I'll tell you that the county and the city are aligned. If you look at the health advisory from the county today, they're of the same position for them, you know, based on some of the metrics that I just presented. And so I think we should be united as a region. And I think anywhere that we can get that level of support, we would greatly appreciate it. Yes.
Okay, great. Thank you. No further questions.
Alderman Gunther.
Thank you, Chairwoman, and thank you, Dr. Mahdi. I think you have all of our support, and we all recognize how difficult it is keeping up with this changing tides of what's going on. I guess, you know, what you just said about it's important for the region, for the St. Louis City and St. Louis County to kind of keep an alliance so that we don't have a lot of confusion, which you know, you mentioned how many emails you're getting from concerned citizens. I think myself, I can empathize with that. The number of phone calls and emails that I've received this weekend concerning what the city is going to do on renewing a mandate versus a recommendation. My one question is how does the city, if the city were to align with the county on the strong recommendation, how does that also kind of correlate with what Illinois just did? Because I have a lot of people that either worked in Illinois and say, oh, well, Illinois just lifted. Can you just talk a little bit about how Illinois changing affects kind of, or I guess aligns with what we're doing? Because Metro East is kind of our, our greater community here also. So
I'll be honest with you, Dan. I don't know a lot of the specifics of where Illinois is. I think you're absolutely right that that's an important thing to factor when we're talking regional. Unfortunately, this happened on Friday. It's really hard to work on these things over the weekend. And so what I can assure you is that my staff and I will, we will continue to work with the county. We'll reach out to Illinois. But what the public, I think, and where you can be helpful as leaders over your respective wards and with your residents is just, I don't think people understand that the city, the county, Illinois, all have different bureaucratic structures, different ways that policy is able to be implemented and placed, right? We have a charter system and a board of aldermen process through which we can operate. It's the reason why we're one of the last public health jurisdictions in the state that were able to even keep a mask mandate in place over recent weeks, as you know. The county does not have a similar structure. Illinois has their own process. So when we meet, there has rarely been a time where we've met and not been aligned, right? What that means we can actually do differs. And so when you see that, a lot of the times it's based on that bureaucratic process and not on the fact that we're not trying to keep things as consistent for the public as possible.
Okay.
And I'll be very, very transparent with you there that I will veer from that unified approach where I feel like the data doesn't support it. And I'm in a position to utilize our very helpful and very strong charter and board of aldermen process, as I've been able to do with the mask mandate to this point.
Okay, yeah, and I guess this is just more comment here, but going through quite a few calls and emails, I have a very similar split. I have the parents of young children that are saying, my kids can't get vaccinated yet, and healthcare workers that are encouraging us to continue to strongly push for masks. At the other side of it, though, I have quite a few businesses that have reached out to me over the weekend and said, hey, the county in Illinois are lifting the mandate, and they feel like for months now that there hasn't been any enforcement really in place. So they're the ones taking the brunt of the anger from people that walk in to a restaurant or bar and they have to ask them to put a mask on. So I guess, the strong recommendation, we're really asking the business owners to say, do what you think is comfortable. And, a lot of the business owners that are contacting me are saying, they feel bad because they're making all their servers, all their kitchen staff, all their workers, bartenders, all wear masks because they want to comply, but yet they feel like they can't enforce it with their patrons. So, or they get a bad reputation for enforcing it with patrons. So, it's just comment. But I fully agree that this job that you've taken on here is a tough one right now. And so we all appreciate the work that you and the staff are doing. And if we can do what we can to say we highly recommend it, then I think, it'll be up to the individual, our citizens and our business owners as to what they feel like they can do individually. So thank you very much for your presentation, and thanks for the work you're doing. So no further questions.
Thanks, Dan. I really appreciate that. I think it's such a fair comment you made, and a well-balanced one. I want to be very clear. Business owners have been put in an impossible situation during this pandemic. They have really, really been put in an impossible situation. Anytime that the onus for enforcement of something that's critically needed is taken from, the federal and state level where it should reside and put into the hands of people who are not empowered to do so, that's a really, really impossible position to be put in. My heart goes out to them. And especially when they also are responsible for their livelihood and the livelihood of their staff and people they love. That's really difficult, right? At the end of the day, though, Dan, my job is public health, right? And so what I don't respond well to, I will always respond with empathy, with understanding when it comes to how that impacts them, their safety, how it impacts their livelihood. I don't veer into the conversation of peer pressure, inconvenience, you know what I mean? And words of privilege, right? People just don't want to mask. That's where the buck stops, because that's really not my responsibility as a director of health. There are real long-term consequences. Nowhere in this conversation have we even talked about long COVID, right? Nowhere in this conversation have we had a real conversation about how we put equitable, how we plan for equitable rollouts of these types of dramatic changes to protect the most vulnerable. So while I empathize, the buck stops at, I just don't want it. Just drop it today. It's inconvenient. You know what I mean? When I go and talk to schools, I tell school teachers that they're frontline heroes the same way I think of nurses as doctors, because they have vulnerable folks. And to a lesser degree, but still to a certain extent, when you own a business, you know what I mean? There's a responsibility there for your patrons and your staff. And if there is data to show that it could really impact negatively those folks, I really have been so proud to work alongside business owners who have said, please teach us and direct us so we can do what's best for residents. When that's the message, I'm on board, right? When it's about livelihood and other, I'm on board. Unfortunately, my job is not business and economy, but I try to work with businesses as much as possible. You know what I mean? And let's be honest, one of the criticisms has been, well, why does this entity X, even get involved with, business or economics? It should be focused on public health. So in all fairness, I hope that's where people see my job, whilst understanding those very real concerns. So I do say to business owners, especially small business owners who have it even more difficult than businesses with higher budgets, thank you. I'm so sorry for the position you've been put in. Please continue to work with us so that you can do the best, you can make the best decisions to keep your staff and your patrons as safe as possible. And for now, I believe that is strongly recommending folks to mask. And where you can request it of your staff to continue to do so too.
Yep. Okay.
Because they just don't know. They don't know which of their patrons are immunocompromised. You know what I mean? And should families with young children not be able to go anywhere because of these changes? I mean, these are the sort of things we need to consider as a community. Sorry, Dan. It's going to be a long lecture-y day for me.
That's all right. You deserve it. Yep. All right. Thank you. No further questions, Madam Chair.
Alderwoman Martin.
Thank you. And, I really, Dr. Mahdi, I really appreciate your just candid approach. I think that's a great place to start. I have a couple of questions. One, do you know why St. Louis Public Schools did not participate in the weekly school testing that was available to them for free through the Missouri Department of Health?
I don't know the details and I don't want to speak on their behalf. I think they should be asked explicitly, but when I meet with them weekly on calls, I know that there were many weeks at which antigen tests weren't available from the state. They had to suspend the program they had from schools for quite a long period of time during the surge, especially because there just weren't antigen tests available to be able to supply all schools. Past that, I have no details and I couldn't speak to it. That would have to be a question for the schools.
Sure. Yeah, I mean, I know they explicitly just decided not to participate in that from the get-go, since it was available in August. And there were a lot of news stories about that. So that's one, issue I have is that, schools, the school system made that choice. And then, also just sort of with, I mean, I, obviously am around out and about in St. Louis City. And, I don't know what to, I will say I've had more constituents say that they want the mask mandate lifted than not. But I'm very empathetic to folks that, have kids under 5 or are immunocompromised for sure. I am just sort of wondering if you could kind of level with us without, enforcement, or at the end of the day, it's really hard for me to say like, hey, we need to continue a mask mandate when we are allowing large events, or you have to wear your mask walking to your table, but then you're in a crowded restaurant without your mask or bar. So I just sort of don't know what the response is to folks when they're like, hey, I'm at Schnucks and, no one's really wearing their mask, or, St. Louis is allowing these large events where people are unmasked. I mean, how do I level with constituents in that way?
I mean, you're in the same position, I'm in, right? That's the reality of the situation. Really, if we had had a national standardized program, if we were not in a position where not only different states, but different cities and different counties can have different mitigation strategies and approaches, if public health wasn't so severely underfunded, right? If I had triple the staffing capacity that I had to be able to send folks out and do more around capacity, this wouldn't be an issue, but that's not the reality. So the question, and this is me leveling with you. I don't know that the question is fair at our level. We are bearing the brunt of decisions and situations that have happened at much higher levels. Do you know what I mean? But if the question is, can the Department of Health support businesses and go to every single Schnucks on a daily basis to help with enforcement? Absolutely not. I don't have capacity. I don't have staff, right? If there's policy or legislation, I would love to have people reach out to me as to how that can be done. But in reality, unfortunately, as it has been throughout this pandemic, the onus has been left to individual. We make these recommendations and then folks are left to make the difficult decisions as to what they're going to do and how they're going to try to implement those things. And now that this new wave of recommendations from the CDC came about on Friday, it's made that even tougher, right? Because you're right, we're going from a mandated position, which a lot of folks will tell me straight up, even then that wasn't being widely enforced, to a recommended one. Very difficult situation to be in. Are we at a better place than we were though? Yeah, I'm not trying to preach that we're at some sort of Armageddon. The data speaks for itself. The numbers are in a much better place. But I do think we should be thoughtful about what this looks like for a society. And I think for people who are healthy, vaxxed and boosted, or who don't care, right? This gives them the freedom that they want to do what they want. But it leaves a lot of members of our society not able to engage and even more stigmatized and even more isolated, right? Because they cannot partake. And I don't think we should want that for communities as a society. So I think the question you're asking me is, how are folks supposed to actually implement and enforce this? And unfortunately, it's going to have to be people who are responsible for different jurisdictions, whether it be your household, your school, your small business, sitting down and deciding where you're going to go with those recommendations and how you're going to enforce. If you're asking me if DOH or any other city entity has the ability to support them above what we already are doing, the answer is no.
Okay. Yeah, I mean, that's helpful. It's just, to me, it's like we make these recommendations or have a mandate, but then, I mean, at the end of the day, city government is allowing for very large scale unmasked events. So
and allowing is difficult, right? Because again, I'm a director of health with 90 staff for the entire city. When I took this job, I had one animal control person for the entire city, every complaint. When I took this job, there were 3 contract tracers for the entire city. And that was averaging 150 to 300 cases. So the word allow is difficult for me to accept because it's only as much as we're supported, right? So at no point is DOH saying, go ahead and have Mardi Gras, right? At no point have we supported any of those events. That's never happened. But if the expectation is that somebody should be writing in from DOH to shut things down, what I'm saying is we don't have an enforcement or capacity to do so. So we have never supported those types of large scale events, especially at times where the data just didn't support it. We never have.
Sure. And I didn't mean to single out you. I just meant kind of government as a whole from the perspective of my constituents or business owners.
No, it's impossible. No, me and you are on the same way. We're the same place. But I'm using this forum as an opportunity to have real life conversations because I get some real self-righteous and very sort of rude emails, communications to my staff, and I can take it. You can email me 300 times a day. This is the job, and I'm happy to have taken it. But when my staff get that kind of abuse, that's when I start getting real testy, because what you're not going to do is take people who have literally upheld all of public health with very minimal resources during a pandemic and complain about the job that they've done. That should be leveled much higher and is a reflection of how we've handled this as a nation, not how local public health departments have done. They have been nothing but heroic. And I can say that confidently, seeing what they do. But you're right. I mean, it's infuriating. I can't even imagine what it's like for, daycare leaders, what it's like for teachers who saw this on Friday and had to come back to school on Monday. Healthcare workers are just, can you imagine what this is like for them? So it's really hard, and we've got to try to get through this together.
Okay, thank you.
Alderwoman Middlebrook.
Thank you. Thank you, Dr. Monti, for all of your work. You've basically answered my question, which was regarding children and people who are immunocompromised, and having, a business with people in healthcare, and a child who can't be vaccinated, and getting so many calls since Friday from people in the community. Should I, shouldn't I? And I've just been recommending people continue to wear your mask, because at the end of the day, if you go home and you have a child such as mine who can't be vaccinated, but who also has an underlying condition, I want to keep her safe and keep my other child who has been vaccinated, but has asthma safe. This is just a situation that is mind-boggling to some aspect, with people not wanting to wear a mask. I get it, because I'm tired of the mask too. But I'm thinking beyond myself about my children, as well as my clients, and then people, on the outside world who can't, I guess, fight for themselves. So thank you so very much.
I'm so sorry to you, and I'm sorry to everyone. Honestly, even people who don't have kids, because I think sometimes it gets so unfair that it's only the parents who are going through it, right? Everybody has gone through it. And it's really hard to adjust so quickly and to figure out how to do these things. And when we get through the questions, I'm actually going to ask a question back to you all about what you need from me to make this as clear as possible for you, for me to be able to support you as you're supporting the health department, because it's this board, the Board of Aldermen have been, I cannot tell you how you all have been such a great resource to me and my team. You have always been polite, helpful, gracious. Even when we're late on things, you've given us a lot of grace. And so I just hope that this relationship continues to be bi-directional, and that you can give me some feedback about what you'd like this to look like, so that you can do the job you need to do to support us. Because really that's how this is going to get done.
Alderwoman Rice.
Thank you, Madam Chair, and thank you, Dr. Mahdi, so much for your leadership and your clarity and your integrity in addressing these issues. I will be honest, I had a hard time even trying to engage with the recommendations from the CDC on Friday, because there's just so much information there. And I am grateful that we had this time this morning to hear your perspective on it, as you are also sort of piecing this together, as this is new. I think it was really an interesting point to note the drop off of testing. And I'm wondering, do you have a quantification of that, of how many tests were administered, that we could show that specific drop off?
Yeah, I can get that to you.
Number.
I can get that to you. So the slides that I send you all weekly to bi-weekly have a testing component, so you can always refer there. And then I could have my epidemiologists add from some of our partners, because we get those testing numbers from what we get from state, but those don't include some of the partnerships. So if you remember, I increased testing capacity by 1,500 to 2,000 more tests a day in the city through partnership with Nomi Health predominantly. And then we had a partner with DHSS, which recently closed down, but the Nomi facilities are still open in the city. And so they send me their weekly numbers as well. So I can ask Matt and our team to add those numbers so you can see that drop off. But what they do weekly for me, Nomi does it. And then, like I said, those slides I send you have the testing numbers as well, is they show every week what that curve looks like and what the absolute numbers are. So we can definitely do that.
Sure.
And continue
Okay.
to.
And then I guess as far as recommendations for testing for folks, because the symptom list at the moment is sort of baffling. And as someone who is a seasonal allergy sufferer here in St. Louis, right? Every time the temperature goes up and the stuff starts flying around in the air, then I start getting the tickle in my throat. I start getting the sinuses and everything. Realistically, what should the average citizen's testing look like? Is it any time that there's any sort of symptom, should we be trying to get a hold of a test, or that's been such a difficult thing to try to figure out for myself as well. It's like, at what point is this serious enough that I should get a test, or is it just if I'm going to be interacting? Like, do you have any guidance around that?
And I really appreciate it, because you're someone that I know has an extraordinarily high level of health literacy. So if it's confusing for you, that's a signal to me that it's time for us to do some re-education around here. Anyone who has symptoms should get tested. And those symptoms, as we know, are really broad, right? Really, any upper respiratory infection time should get tested. And then if you have been identified as a close contact, you should be getting tested for those two areas. That is the criteria. And I think what we're seeing here is a little bit of pandemic fatigue, where people, it's annoying to have to jump in your car and look online to where you have to go and find a test, and maybe you have to book it online, or, you're at work. And so some people may be leaning more into, well, this is likely my allergies, or maybe this is just a cold, or my kid just recently had this, it could be that, or let me wait to see if I get better, and then I'll go test then if it doesn't after X number of days. But in the meantime, you may be putting other people at risk. So it's just about being vigilant and reacquainting ourselves with what those symptoms are, and then testing where we can. I think a lot of folks had access to the federal program for antigen tests at home. I say to use them. The DOH states on our website how to interpret that information if you're going to use those tests. But we know that a lot of, again, the disadvantaged don't have access, which is why starting this week, DOH is going to be sending antigen tests and N95 masks to vulnerable populations, including the unhoused, congregate living facilities for the elderly, city employees, and we're trying to get them out to school teachers as well. So that distribution may take a little bit of time, but we just, got word that our stock should be in this week. But I think that's the answer to the question. Yeah, no, it's really great. And so what I'll do is ask our comms team to do a little bit more education about reminding people where to get tested to support that drop off, like you said. Like when is it appropriate to get tested?
Yeah. I think that's one of the difficult things is, watching the numbers go down and say there's not as much illness virus circulating in the community. It is still a serious illness when folks are getting sick, and particularly those who are vulnerable or unvaccinated are getting sick. It is still a serious illness, regardless of whether our hospitals are overflowing or not. And so trying to keep that in mind as we're 2 years in and we're all getting fatigued in this, I think is just so tricky. And I'm wondering also for workers who want to continue to mask in their workplaces, I know, like, do you have any guidance to? And I'm sure that an employee, like a good employer, should allow an employee to continue to mask if that's what makes them feel comfortable and safe, or if they need to do that. Is there any resource out there or somewhere that we can direct a worker to if that becomes an issue?
Not yet, because this is happening in real time. It's such an excellent question, and it kind of partners to what the comment I got on Friday about the stigmatizing of this and folks not being put in a position for this to become a problem for them to work or to do basic functions. And so I think one of the things I want to make sure the Department of Health is doing is I think I told you guys that we built a listserv of over 1,000 businesses, and I don't believe we've captured all of them, but I'm hoping that, through networking and other things that will filter out to most of the businesses in the city. that we want to, as part of the reason my staff is working so hard this week, is we want to send businesses specifically, just like we did in the surge, we sent businesses very specific guidelines around ventilation and other business practices that are a little bit more specific than what we gave to the general population. And we'd like to do something similar. So we're preparing that for schools, and we'd like to prepare that for businesses too. So like I did last time when we did that, I sent those all to the Board of Aldermen with all the attachments. I said, here they are for businesses, so you can use those. Here they are. Here's what we sent to schools, so you can see that. We'll do the same thing in my weekly or biweekly emails to you guys, so that you can use those to also help educate or to give resources to your constituents.
Absolutely. I really appreciate that. And I very much hate that masks were identified as somehow a scarlet letter. When you had said, for the 24 conditions that were listed by the CDC, that could be 70% of our population in the city with only 60% vaccinated, 25% boosted. That is it. I echo your plea to our city to be kind to one another in the choices that we make, whether we're masking or not. And I guess the last piece of that is the vaccination efforts. So I know we have a bill in front of us today talking that refers to a grant for vaccination outreach and that type of thing. And are we seeing new folks coming to get vaccinated? Like, are we seeing growth in that area, or is there some way that we can continue to be helpful, or that the city can be helpful in trying to increase those numbers?
Yeah, so let me finish your last point, because Craig Schmidt just flagged something for me that I think is such an excellent point, and thank you, Craig, for that, is that the Americans with Disabilities it may be an access point for folks within their institutions. So the equivalent, if you have an equivalent, HR is a great place to go to if you're having problems or think you're being stigmatized, ombudsman, if you're in a hospital or healthcare provider settings, but definitely with Americans with Disabilities as well, reasonable accommodation issue, maybe something that folks want to lean into if it even gets there. I'm hoping it won't. I believe that people are frustrated, and sometimes they express that frustration not as kindly, but I think at our core, we all want to do what's best for not only ourselves, but our community. So I'm just going to believe that the city is going to continue to do that and encourage folks to lead with that, with kindness and with empathy. With vaccinations, I'll be honest with you, I've seen a steep drop off in people reaching out to us for vaccination events. It feels like a lot of people felt like they'd done their job when they did first and second doses or the first wave, but I haven't seen a lot of people come back to us and say, let's do booster events. And now that I've given you this data and you guys get it from me, at least bi-weekly, I think that we'd love to hear from you and any other folks who have the capability to provide locations that could be amenable to booster events, so that we can start to signal that, hey, this isn't it. One of the things that concerns me every time the CDC drops guidelines like this is that people see it as a herald of we're done. And that's not it, right? So we need to work together to really drive the messaging that we're not done. Sure, there's been a shift in metrics, and I think, for the most part, that's appropriate. And sure, that means that mandates in the way that they've been put in place may not be a thing of the future, but that doesn't change what we still should be doing and the data-driven approach, as well as the fact that the strongest tool in our toolbox are vaccinations and booster shots. So simply, if you as aldermen and women have the capability to partner with us, as you're looking at the zip code data that I give to you in those slides, you can easily see if you're in one of those zip codes and really be thoughtful about linking us or directly partnering with us for booster events. But the city of St. Louis continues to do at least 3 to 4 a week. And that's not even including our partners and FQHCs who are still vaccinating and boosting folks. So we've just got to keep pushing. I think parents and caregivers have had a greater lack of confidence in vaccines and boosters than adults have had for obvious reasons. And so we're working really hard to try to do more education around that and to see how we can, decrease hesitancy and increase confidence there too.
Okay, wonderful. Thank you again so much for everything that you do.
Sure, thank you.
Before we move to the alderman from the 18th, if any members of the board who are not on the Health and Human Services Committee would like to ask Dr. Mahdi a question, if you could raise your hand, I'll definitely call on you. Alderman Todd, do you have any questions?
I would just, thank you, Madam Chair, and thank you, Dr. Mahdi. I would like to commend you for your transparency, as well as the fact that you expressed the fact that priority should be given to healthcare, to hospitals and healthcare workers and other people. We could save a lot of lives, and I realized that if I know your office probably could do more education if you were able to send. I was just thinking this week about the same thing you said. If each ward had 5, if your department had 5 people who could go door to door in each ward and find the most vulnerable, educate people, that would be, we could save some lives and we could really get to herd immunity quick. So that's why I've advocated over and over again, we have to shift our money in this city away from so-called public safety and talking about gun violence all the time, and end up and shift it to other departments so that we have a balance. Because when we have people dying from COVID and we don't put the same priority as we do with the media hype about gun, it's real, but when we could prevent that too. But death is death, and we could more easily prevent gun violence through. I'm still on the same subject of healthcare workers, whereas we have drug addicts. They may end up with more, the most vulnerable through no fault of their own because they're addicted, end up more vulnerable because they take all these risks. Other people who are out there who don't have information and who are mentally and physically ill, and I call any illness when you're not functioning at your full capacity. But my main point is that and I'm pleading to the older peoples too, we must change. We must spread from spending almost half our money for so-called public safety, which we're not any safer, and start letting put more money into the health department and let the health department take care of health, which is including drugs and everything, and let the police get back to their job, which is to only get in contact with the citizens when they suspect a crime has been committed. These are professional people, and we veered off where we're saying the police should make us safer, which is a conflict of interest, because then they'll lock you up. But the point I'm making is we need to put more money into healthcare. We need to, but I will go to the other department, to forestry, parks, because parks is a healthcare issue, because then people die from COVID-19 because of the fact that the weaker your immune system is, the worse health you're in, the quicker you are to die. So I think that, and I'm just asking Dr. Monty, is that correct that you die if you have high blood pressure, diabetes, if you're overweight, you have other chronic diseases? My question is, does it increase your probability of dying from COVID-19? Thank you, Madam Chair. Thank you, Dr. Monty. I'm through talking because I get a little passionate about us not prioritizing prevention over.
No, you have every right to be passionate, Alderman, and thank you for those words. You're absolutely right that, those pre-existing conditions, high blood pressure, diabetes, and a list of others that I can send this board as well, and that was listed in the new CDC recommendations, do put you at increased risk of severe illness and death. And that's why we see the disproportionate impact in Black and Brown communities and have seen it throughout the pandemic in the city of St. Louis, is because they're more likely to have a lot of those healthcare conditions. I must apologize. I have to leave for an urgent meeting at noon. I'm happy to return. I think there's a lot more to discuss. And I would really ask that folks please email me any additional questions that they have, but also any additional requests about how I can make this transition easier for the city moving forward.
Dr. Mahdi, thank you so much for your time today. Just a couple of quick housekeeping items. If you could forward the presentation that you gave to all of us, to either myself or the clerk, so we can disseminate it to the committee members, I would appreciate that.
Will do.
And yes, Alderman Narayan, if you would email either me or Dr. Mahdi your question. I saw you had your hand raised.
I will. Thank you.
Okay. Thanks for your time, Dr. Mahdi, as always. Appreciate it.
Thank you. Take care, everybody.
Next up, we're going to move to Board Bill 207, Alderwoman from the 11th.
Thank you, Madam Chairwoman. please see before you Board Bill number 207. This is a piece of legislation that was suggested to me and Alderwoman Ingracia, or Chairwoman Ingracia, to essentially have restaurants present healthier choices for children's menus. I just want to start from the get-go that this doesn't prohibit parents from making whatever choice they ultimately want for their child to go for what they want to eat or drink. But as far as making or having parents stop and think about what they're ordering for their child, or as a mom of a young child, me saying, you know, these are your options, milk or water. It certainly it makes it easier to make a healthier choice for your child. This is based on data and pediatric advice, and I am hoping for discussion. I'll be honest, I do have an amendment drafted to add sparkling water to this, but as a parent who apparently was doing maybe the wrong thing for her child, it does erode tooth enamel, and it may not be the best thing for a child of at a young age. So, I know we have a lot of parents on this committee and grandparents, and I'm open to thoughts about that. But really, we do know that childhood obesity is a real problem. There's been some discussion on this where people have said to me, well, we don't regulate other menu items, but we do regulate things all the time that we know are harmful to folks. And we certainly know the toll that it takes on people over time, on humans over time, when they're making poor diet decisions throughout their life. So I think this is really worthy of discussion. I'm open to thoughts from colleagues, and with that, I will entertain any questions. We do have some folks here that are here to testify as well.
Thank you, Alderwoman Martin. I know that Mara Gray with the American Heart Association is here as one of your expert witnesses on the topic. So we'll have her testify. And then we have two people from the public who would like to testify as well. So Mara, you're up.
Yeah, thanks, Alderwoman Martin. We appreciate you bringing this forward. Chair, members of the committee, my name is Mara Gray. I am the Missouri Government Relations Director for the American Heart Association, and I am also a resident of St. Louis City. So this is important to me for our respective region. So you might wonder, why is the Heart Association worried about healthy kids' default beverages? Well, we know that about 2/3 of youth living in our country consume a sugary drink every single day. And what that equates to is that the average kid is consuming over 30 gallons total in a year. And just to give you a visual representation, 30 gallons equals an entire bathtub of sugary drinks. And so we know that without change, about 40% of our kids are going to end up with type 2 diabetes. And type 2 diabetes makes you 2 times more likely to develop cardiovascular disease. So initiatives like this really get at the root of cardiovascular disease, which is part of our mission, is to reduce that. So we're doing that at the ground level with this ordinance. And just to point out, after Dr. Vadi's presentation, issues like this also put you at higher risk for things like COVID-19. So we're just trying to reduce those comorbidities that you see going on right now. And you might wonder, on behalf of restaurants, we know about 80% of top 200 restaurants, the chain restaurants at least in our country, they're still serving sugary beverages as the default option. So this is just a way to make sure that we're cutting into that sugary beverage intake whenever parents are taking their kids out to those restaurants. It's also about a health equity issue. We know that the beverage companies and restaurants also target Black and Latino communities for sugary beverages. So this is also a way to cut into health equity as well. And then, not to mention, this is a really low to no cost way to make a big impact. In areas that we have passed this ordinance across the nation, we're not seeing a huge impact to restaurants, or impact to health departments because water suffices for the ordinance. I have also spoken with health departments and governments in Baltimore and Golden, Colorado, where this ordinance is already being implemented, and things seem to be going very well and very smoothly. I also want to point out in the penalty structure that it is an initial warning. We're not trying to get at restaurants or, go out and get them, especially in light of COVID. So the first penalty would just be a warning. We would just say, hey, this is something that we've passed in our city. We would really like it if you would support parental choice here at your restaurant if you're serving a designated kids meal. And before I close, I just want to point out a few things. Other Midwest cities that have already passed this are Cincinnati and Cleveland. Indianapolis is also thinking about an ordinance on their own. And then our neighbor state, the state of Illinois, has passed this initiative statewide already. So I hope that we in St. Louis can do the same. Thank you.
Thank you very much. And I apologize. We have a new requirement that we need to swear in our witnesses. So do you affirm that the testimony you just provided and the testimony you will provide is the whole truth and nothing but the truth?
I do.
Thanks, Mara. Sorry about that. Thank you for being here. I'm going to open it up to the committee for questions. Alderwoman Green. Alderman Gunther.
Thank you, Madam Chair. So I support this Alderman from the 11th. I guess my only question is, as a kid that was raised on apple juice, I do realize that it was a sugary product, but have you had any consideration for adding juices, although they are sugary?
Yeah, so I learned from my own experience as a parent that the dentist says that juices are just as bad for your teeth and health. So we did talk about that, and it does seem, juices do seem like they're pretty benign, but in actuality, they have a lot of sugar in them. And the issue is a lot of times they're not packaged under a certain amount where it is, makes it a healthy choice. It's like twice the ounces that are recommended.
Okay.
That said, a restaurant could still offer juice on their menu.
Okay. All right. That was my only question. Thank you.
Thank you.
Alderwoman Middlebrook.
I think this is a great idea. I would like to be added as a co-sponsor on this bill. Who absolutely she does pretty good making good decisions with water and milk. She, however, is allergic to cow and refuses to drink any other milk but cow's milk. So almond and everything else. We went to goat milk, rice milk, everything. And so she just prefers the cow's milk, and we just kind of watch for the breakout and pray that it's minimal. So I think this is absolutely wonderful idea. Thank you.
Thank you.
Thank you, Alderwoman. Alderwoman Rice.
Thank you, Madam Chair. And I'm curious, Alderwoman Martin, if you could just describe like what a physical change on a menu would look like. So I will confess it has been quite a while since I've looked at a children's menu on, but what is a good example of something that you would see now and what it would be under this new ordinance?
So right now, when you go to some restaurants, I really have noticed just more and more, so many restaurants just not making these offers anymore. But you would, get, say, a turkey sandwich, chips, and then they offer a lot of times a juice box or a chocolate milk. And this would make the option water or a low-fat milk.
Okay, so it's really just like the original package of the deal would be a water or milk included in the deal, and then if they wanted to add something else, like the restaurant could still include, that the restaurant carries sodas or it carries juices or those types of things.
Sure, yeah. So they could still offer that. They can, it's up to them what price point they want to make that. We're not mandating anything on that or suggesting anything. I love to order a kid's menu, and I often will order myself a different drink. So they can still make that happen.
Okay, that's great. I was raised that we only got water because water was all we could afford at the time. So I understand that, but also the juices, Dan. I loved my apple juice and still do. So but I totally understand that it is really hard to tell what is good juice, like what's healthier juice versus what's just packed full of sugar and that kind of thing. So I think it makes sense. I think it's good to try to address this at a level that can have hopefully a positive impact on kids' lives. So thank you for this.
Thank you.
Alderman Todd.
Thank you very much, Madam Chair. Thank you, Alderwoman from the 11th Ward, for presenting this. I would like to become a co-sponsor. I would like to be a co-sponsor. I would like to have my name added.
Madam Clerk, please make note of that. Do you have any further questions or comments?
No, I do not.
Thank you, Alderman. Do any of the aldermen who are not on the committee have any questions for Mara Gray or Alderwoman Martin? All right, thanks so much. I'm proud to be a co-sponsor on this bill. One thing I did want to mention, because we haven't talked about it, is that Craig Schmidt with the Health Department has been working with us on this. And so the Health Department is supportive and collaborative in this effort. And Alderwoman Martin, I recognize you to close.
Thank you very much. Yes, on that note, it would just be added to the list of other things that our health inspectors are looking for when they make a visit. I really appreciate everyone's support on this. I do think this is just a great, easy step towards ensuring our kids' future. The data is there. So this puts them on a better trajectory for a healthier lifestyle. And with that, I will close.
Thank you, Alderwoman. Alderman Gunther, did you have one more comment before we move on?
I did. Thank you, Madam Chair. I was either going to just ask that my name be added as a co-sponsor or see about just passing this out of committee and bank. I guess I'll make a motion to pass this committee or pass this bill out of committee and bank.
Second.
Madam Clerk, please call the roll.
Alderwoman Green.
Hold on. We can't do that yet. We have public testimony. I apologize. Do you want to make a motion to?
We're a well-oiled machine today.
Yeah.
Just the motion to in-bank it. Sorry. You're just saying in-bank versus passing it.
We can all go on as co-sponsors. Can someone undo their first and second and then redo the motions?
I take back my second.
I'll take back my motion.
Would you like to make another motion, Dan?
What should it be?
A motion to add all the members of the Health and Human Services Committee who are present to the resolution.
Yes, I would like to make that motion.
I'll second that.
Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Aye.
Alderwoman Martin.
Aye.
Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingracia.
Aye.
6 aye votes.
By your vote, you have sustained the motion. And now we will move on to public testimony. We are going to do pro and then con. We have 2 speakers and you will have 3 minutes each to testify. And you need to be on camera in order to do so. The first person we have is Erica Williams. Are you with us, Erica?
I believe Erica had to drop off.
Okay. We will move on to Robert Bonney with the Missouri Restaurant Association. Are you still with us, Mr. Bonney?
Up here. Okay. Hopefully my connection will allow you to hear me.
Mr. Bonney, could you hold on for just one moment? I just need to swear you in quickly. Do you affirm that the testimony that you are about to give is the whole truth and nothing but the truth?
Yes, I do.
Okay, I'm going to give you 3 minutes and then open up to Q&A from the board. Thank you for being here.
Sure, thank you. My understanding is that I submitted some written testimony that's been forwarded to you or will be. So I will be very brief to stay within the time limits. Our issue with Board Bill 207 is that we view it as very restrictive and a punitive default beverage policy, and that it includes only the two options that have been noted by previous speakers. So our proposal is to make the following changes to the default beverage policy to allow sparkling water and flavored water with no added or natural artificial sweeteners. This would not provide any additional calories, total sugar, or added sugar compared to regular water, but would allow restaurants some options to offer water in forms that children enjoy. We also propose to include flavored milk. The USDA put out a final rule regarding flavored 1% milk in the school meals program, among other topics, and this final rule will be in place for at least the next 2 years. We also believe that this can be done in ways that do not make this materially different than unflavored milk, but does increase the palatability with children so that more milk is included and less milk is wasted. I believe that the school lunch program in St. Louis allows for 1% flavored milk in schools. We also propose to allow non-dairy beverages that are nutritionally equivalent to regular milk in serving sizes of 8 ounces or less. We believe that a limitation on serving size is preferable for eating establishments, allows them greater supply options as opposed to a caloric threshold. Although if that is not agreeable, then we believe the caloric threshold should be increased from 130 calories to 150. And we propose to allow 100% fruit juice or fruit juice and vegetable juice, or just vegetable juice on its own, combined with water or carbonated water with no additional natural or artificial sweeteners. And other localities have agreed to do this, we believe, Louisville, Baltimore, New York City, among some others. We believe that 100% fruit juice with no added sugar can fit into a balanced diet. And
Mr. Bonney, your time is up. Thank you so much for testifying. Do any members of the committee have questions for Mr. Bonney? If you would raise your hand. Alderwoman Rice.
Thank you, Madam Chair. My question was about the sparkling water. Are there, like, I am someone who I don't drink soda. I just don't enjoy it. I do like a sparkling water or lightly flavored sparkling water. But I have noticed that there aren't really guidelines around what is in those beverages and what types of minerals or chemicals or that type of thing. It seems very unclear as to what could potentially be a part of that. And I've seen some studies that seem to raise some questions about what types of what types of things could be found in those beverages. So I'm curious if you have any other information about that.
I can look and see if I can provide some, but these would not have added natural or artificial sweeteners. Now,
Okay.
what else they have, we should be cognizant of, agree, and maybe the amendment could address that if there is one forthcoming.
Yeah, I guess that I'm curious. There's so many more drinks available on the market now than there were when I was a kid, and trying to have parents make informed decisions about what's there. Does your industry have guidelines around what types of nutritional benefit you have to have in order to provide something on the menu?
we have a voluntary program called Kids Live Well, and that has a default beverage component to it. It's voluntary, but it is gaining popularity with the restaurant community.
Okay. All right. Well, thank you.
And these
Appreciate it.
things that I propose are
Thank you, Mr. Bonney. To your point, we do have written testimony from you in our Google Drive for committee members to reference, and I believe you have my email address. So if there's any further information you would like to provide, I'd be happy to disseminate that to the members of the committee.
Sure.
Alderwoman Middlebrook, did you still have a question?
My question was pertaining to, I have friends who take their children out to dinner or whatever, they order water, but they use the artificial sweetener packets. How's those compared to drinking like an apple juice?
Either Mr. Bonney or Ms. Gray, do you have any information that you can provide on that?
I believe the Heart Association does have information regarding artificial sweeteners. They are definitely not a best practice. That's why we are encouraging just unflavored water and low fat milk at 130 calories or less. But I'm sure I can dig up some information for you.
Okay, and if you would pass that along to me, I'll make sure the members of the committee get it. Any other questions, Alderwoman Middlebrook?
None, thank you.
You're welcome. If no one else has any further questions or comments on this bill, I'll entertain a motion to pass Board Bill 207 out of committee with a due pass recommendation.
So moved.
Can I get a
Second.
second? Seconded by the Alderwoman from the 9th. Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Aye.
Alderwoman Martin.
Aye.
Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingracia.
Aye.
6 aye votes.
By your vote, you have sustained the motion and Board Bill 207 has come out of Health and Human Services with a due pass recommendation. Thank you for your time, the members of the public who came to testify. We are moving on to Board Bill 150. Thank you to the members of the public who have been waiting patiently to testify. I appreciate it. This is my board bill. I would typically pass it off to the vice chair, but I am going to just request that we have public testimony on the board bill today and then hold for the committee to vote on a committee substitute. Mr. Todd, do you have a question?
I need to, I have an emergency that I need to take care of. Is it possible for you all to still maintain a quorum and if I leave?
Let's see, Madam Clerk, I believe that we do have a quorum still. Yeah, we're fine, right?
Right. You need 4
Okay.
for.
Okay, thanks for letting me know, Alderman Todd. I hope everything is well.
Thank you very much. And thank you so much for the great job you're doing.
No problem. So Board Bill 150, I'd like to just give a quick overview and then I'll handle the timing for the public so that the vice chair doesn't have to do that. It's not the most fun task. It can be a bit tedious. Board Bill 150, which is before you today, is a board bill which would set requirements for the city breaking up encampments on public property in the city of St. Louis. It is not a board bill that allows for encampments to stay in any certain place. There are particular places that could be identified as not available for encampments to be used. This is modeled after a number of other cities who have requirements around the dignity and humanity of our unhoused neighbors. We've had numerous occasions of just chasing the same people around the city in a really problematic way. And it's a waste of capacity and resources, both from a funding perspective and a city employee capacity. And so this board bill would just set some rules and require the city and the advocacy organizations with whom these individuals typically interact to work more thoughtfully together in a best practices way when an encampment does need to be broken up for some reason. And so we're going to switch again. We have public testimony. Each person gets 3 minutes to testify. We're going to go between those who are testifying in support, those who are opposed, and then we have one individual who did not indicate whether or not they were in support or opposed. So Yitzi Simon is the first individual up. Are you with us, Yitzi?
Yes, I'm here.
Thank you for your patience and time being here today. Do you swear that the testimony you are about to provide will be the truth and nothing but the truth?
Yes.
Okay, you have 3 minutes. I'll give you a warning when you have 1 minute to go.
Okay. The importance of this bill is like, it's on many, many aspects. One, we know that it's deadly to break up encampments because we see an increase in overdoses. We see a disconnection from service providers. We see the loss of support from the other unhoused folks. And if we just have a process in place, people will have time to make their necessary plans so that they are safe when they do move on. And secondly, they are citizens of St. Louis. They are citizens of the United States. They have rights just like everybody else. And if you in a house were to be evicted, you get a notice, you get a second notice, people knock on the door, they put a sticky on your door, and that's the process that most of us expect. So we should expect the same thing for all our unhoused folks. That's all I got to say.
Thank you for your time being here. I forgot to ask you, are you representing yourself or an organization or both?
I'm representing myself. Tent Mission did, I believe, provide a written statement, or maybe somebody else from Tent Mission is going to provide our statement.
Okay, thanks so much. Do any members of the committee have questions for Yitzi? Okay, we are moving on to Daniel Pister. Mr. Pister, are you with us?
I am, thank you.
Nice to see you. Do you affirm that you will tell the whole truth and nothing but the truth in your testimony?
I do.
Okay, you have 3 minutes. I'll give you a 1 minute warning. Please proceed.
Okay, yeah, thank you. And I appreciate allowing me to speak today. I live downtown and I've been living downtown for the past 16 years. I'm currently the vice chair of the Downtown Neighborhood Association, and I've been chair of the Downtown Public Safety Committee for probably the last 5 or 6 years. The myth around downtown residents is that we don't want any homeless people in our neighborhood, which is wrong. The truth is we want to see the homeless removed from the streets as quickly as possible, treated for their illnesses, and placed in permanent supportive housing. We've seen multiple different encampments occur over the past few years. We had Interco last summer of 2021, Soldiers Memorial in 2020. We currently have one down by the President's Casino. And then we've had various others that have popped up at 1800 Market, 1600 Market, and then under various interstates. All have been detrimental to the people residing in these encampments and the surrounding neighborhood. The conditions are inhumane. For whatever reason, it doesn't seem to dawn on people that the concentration of homeless people puts our downtown, our city, and the homeless at risk. While there is certainly justified empathy for those that are truly homeless, it seems like the interests of the homeless should not be elevated over the rights of the neighborhood and significant impact on the region's downtown. The proposed bill seems that it would allow 30 days to remove these encampments, which is far too long. It's my understanding that there are some parameters that are currently on the books that the St. Louis Police Department and other city agencies are currently following. And they're not 30 days, they're much shorter. They do give notice, and they do give the homeless services and certain places to go and point them in that direction. The encampment model is archaic. There's
you have 1 minute.
Okay, the encampment model is archaic and is the opposite of what a lot of the homeless experts around the nation recommend. even West Coast cities such as San Francisco and LA have seen a push recently to implement policies that remove these encampments. Ian DeJong, a well-known homeless individual that works with the homeless that has written numerous books, is completely against the encampment model and very supportive of housing first and rapid rehousing and permanent supportive housing. So we want to have the encampments removed quicker, not take longer, and get the individuals that are in these encampments the services that they need so they can be housed. Thank you.
Thank you so much for your testimony. Do any members of the committee have questions for Mr. Pister? All right, we will move on to.
Sorry, if I could, Madam Chair, sorry, I didn't.
Absolutely.
I only got this hand up. Thank you. Mr. Pister, I have a question. What has been your experience with folks after an encampment has been disbanded? What does that look like in your neighborhood?
Well, a lot of times, well, hopefully they're getting the services that they need and being directed to whatever agency can assist those services. A lot of times that hopefully is what's occurring with Biddle House and St. Patrick's Center and some of the other, Gateway 180 and those agencies.
Sure. I guess what I'm asking is, so I can remember specifically a couple of encampments towards the beginning of the pandemic, and then with the one last summer that were disbanded. And I guess do you recall any particular things that you saw at the time that those encampments were disbanded? Folks being out in different areas, or what did that disbandment look like to your neighborhood?
Yeah, well, a lot of the people that are residing in these encampments are the high acuity folks that are going to need an extra push to get them into that housing. So when the encampment is broken up, hopefully that the agencies are tracking those individuals and getting them into the other areas they need. A lot of times the encampment may move to another area. Hopefully those individuals that were in the prior encampment are documented and you can get them into the services that they need.
Okay, thank you.
All right, Mr. Pister, I also forgot to ask you, you did mention that you're on the board of the Downtown Neighborhood Association. Are you speaking on behalf of that organization or for yourself?
I'm speaking on behalf of myself.
Okay, thank you so much. Next member of the public we have is Brad Waldrop, who indicated no position on the board bill. Are you with us, Mr. Waldrop?
Yeah, I'm here.
Can you go on video? You're required to be on video to testify.
Sure. Figure this out.
Take your time. There you are. Thanks for being here today. Do you testify that or affirm the testimony you are about to give is the whole truth and nothing but the truth?
I do.
And are you here on behalf of an organization or yourself?
I'm here for myself.
Okay, you have 3 minutes. I'll give you a 1 minute warning. Please proceed.
Okay, I second Mr. Pister's testimony. He's the co-chair of the Downtown Neighborhood Safety Committee. I'm just a attendee. I go to every one. I'd like to add to his testimony, though, in the sense that I think Alderman Rice asked about, what has kind of been the result of these encampment breakups. And I understand that a lot of people today are kind of referencing the recent encampments along Soldiers Memorial and then over in Interco Plaza. But if everyone recalls, those that were around, there were encampments on the riverfront during the Slay administration. And most of these encampments, including Interco Plaza and those that were along the riverfront, and in a kind of general chaos where lives are lost, not through like cold weather, but through actual murders. That was the case in the riverfront encampments as well as over at Interco Plaza. So this idea that it's going to take longer to break these up, I'm totally opposed to. I think there needs to be specific consideration placed on when considering things like this. You need to consider the downtown neighborhood. It seems like a lot of proponents for these ordinances that are kind of, pro leaving tent encampments in place or putting tent encampments in, or eliminating the panhandling law or the loitering law, which I understand are upcoming discussions. They don't consider that downtown is the economic center for the region. And in my opinion, we need to remove services as much as possible, or a concentration of services from the downtown neighborhood, and spread it out region wide. I also think that
1 minute.
It's interesting that it doesn't seem like anybody's focused on how the region isn't doing their fair share. Heard a gentleman earlier discuss how these are citizens of St. Louis, but I served 5 years on the Bridge board, which was essentially a soup kitchen, and we found that the majority of the persons in need are not from the city of St. Louis in a lot of our sample studies. So I'm opposed to this ordinance, specifically as it relates to downtown and downtown west, and I think it's going to be detrimental to economic activity in those neighborhoods, and I think it's generally a bad idea. Thanks.
Thank you, Mr. Waldrop. Do any members of the committee have a question? All right, next up is Tekka Childress. Tekka, are you with us? There she is.
Hey, everybody. Really
Hi.
appreciate the chance to talk.
Do you affirm that the testimony you are about to give is the whole truth and nothing but the truth?
I do, absolutely.
Okay, you have 3 minutes. Please proceed.
I had 4 points, 2 of which were eloquently given by Yitzi about the rights of unhoused persons and how we all expect that for those of us who are housed. So I'm going to focus a little more on some of the things that have been addressed by people who oppose the bill. I stand completely in favor of it. I think that I would say that actually, oddly enough, I have really never been all that fond of encampments myself, even though for 40 years I've been an advocate for unhoused persons. I've not been in favor of them because I hope for much more for people. I want people to have a home where they're safe, where they can be happy, and where they can be warm and cool when it's hot. I have worked my entire adult life trying to get people housed, and have housed hundreds and hundreds of people. And yet we still find that we have unhoused people. For the past 40 years, we've not been able to end homelessness. We have this past winter at pop-up shelters, which is a good indicator of who is outside. We had 266 people one night in the pop-up shelters in the St. Louis city, while many, many, many were still outside who did not come in. All the shelters were full and people weren't able to get inside. And so my point is that while we would want people to be inside, it's not possible. The process of housing people permanently is cumbersome in many ways. Right now, we saw our number of chronically unhoused people double from 2016 to 2020. And so we are not even successfully able to address this issue. So when we have to break up an encampment, we need to offer people a place to stay. People have to have basic rights for their property. They have to have basic rights to be safe. We have to offer an alternative. I have a response to Mr. Waldrop, with whom I've had these conversations for years, and for Mr. Pfister, if I have your name correct. We could do something really much more creative in how we answer this question. We could set up tiny homes in conjunction with Safe Haven, where people could have strong wraparound supports. If we set up better options for people who are outside right now, we could greatly diminish the problem of people having to move from place to place. So I stand strongly in favor of protecting the basic rights of our unhoused persons and ask us all to work for a long time to create better options, both inside and outside.
Thank you so much. Does anyone on the committee have a question or comment? All right, thank you for,
Madam Chair.
Go ahead, Alderwoman.
Sorry, this time I did actually get my hand up here. Thank you, Tekka, for all of the work that you do in our region. And I am curious, I guess, if you could speak a little bit more from your direct perspective. Tell us, the story from, as a person who works with this community, what does it look like when an encampment has to be disbanded or is disbanded by police and by city work? What does that look like in the past couple of years, especially?
Well, so what happens is people live in this less than ideal situation that they find difficult in many ways, as well as sometimes our neighbors in the downtown area. But yet it is, people gather together for safety to sort of know each other and support each other. People are desperate. They're outside with no place to go. They can't get in shelter, and they find someone who has a tent, who's staying somewhere, who will help them get a tent, and they'll move nearby. When these are broken up, people often lose all their belongings. They think, where can I go where I will be safe? I have no idea where I can go where I will not be moved again. We saw encampments, particularly during, since COVID, we have seen encampments, some groups of people moved around 4 times. There has got to be a better way than moving communities of people around our city 4 times. That's why if we identify places that are safe, that we can offer to people, it could radically change things for them. And I believe we should try to provide tiny homes and not just tents.
I understand. And could you speak a little bit to what does it mean for building a relationship in order to try to get someone the services and the help that they need, or potentially even, work with them on the path to housing? What does the disruption of a quickly moved disencampment look like?
Well, that makes it much harder. Obviously, we lose people. I was in a meeting with a number of people from the city, homeless services and human services last week, and we were talking about the number of people who are lost to the prioritization list. We lose a huge percentage, the greater percentage of people who get on the prioritization list, which for those of you who don't know, is a list where people get brought into coordinated entry and get offered a voucher. They get brought on the list if they're picked, which not everybody is, for a priority pool. They're brought before the WAM, which is the coordinated entry meetings that happen twice a week. At that point, a whole series of things have to happen. People have to have documents that are hard to get for people who are unhoused, especially if, like Mr. Waldrop mentions, they're from out of town initially. They can't get a birth certificate. They have to gather all these documents to be able to be housed. And usually, even without encampments getting broken up, we often lose track of people, but especially when they do, outreach workers who are working with someone might lose track of where they go. People's phones get lost, or they might be government phones that run out of time. So there are numerous things that make it hard to keep track. So breaking up encampments only make this more difficult.
Sure. Okay. And it's my understanding, and I'm just asking if it's yours as well, that this bill aims to create a recognized and agreed upon structure for how we would go about any sorts of breakup and encampment, so that those relationships aren't severed, so that the documents aren't lost, so that we can get folks more reliably in contact with services. Is that your understanding too?
Yes, basically we protect their property, which might include their birth certificate, which they spent 6 months getting.
Sure. Okay.
And so it helps that, but additionally, yeah, it keeps them in connection with people. It has a plan so things don't happen suddenly and we lose them and they aren't hiding, so they don't get picked up again. And I believe, honestly, there are all kinds of things in this bill that protect other residents of the city who are worried about lack of safety or health. There was quite a bit in this bill that I think protects those.
Okay, thank you so much. I appreciate it.
Any other members of the committee have questions or comments? All right, and it looks like last but certainly not least, August Kelly, are you ready to testify?
Yeah, thank you.
Sure. Do you affirm that the testimony you are about to provide is the truth and nothing but the truth?
I do.
Okay, you have 3 minutes. Please proceed.
Thank you. Thank you for the opportunity to comment on Board Bill number 150. I'm a coordinator, a member of Tent Mission STL. We're a grassroots coalition of unhoused outreachers and service providers that support unhoused individuals throughout St. Louis. Our organization strongly supports Board Bill number 150 because we have repeatedly seen the harm that tent community evictions cause and the lack of resources available to those unhoused communities. Our organization has never seen an unhoused eviction in St. Louis that served to further public health. There are never adequate resources available to shelter, much less house the communities previously supporting each other. Instead, highly vulnerable community members have been forced to become invisible, out of sight of businesses and their house neighbors. This invisibility kills when medics, case managers, and winter gear distributors cannot find individuals who are forced to live outside. Several unhoused individuals have died immediately following unhoused evictions in St. Louis because they could not be found when they needed support the most. Evictions themselves are also violent. They are the forced displacement of communities that often rely on relationships for survival. Our organization stocks up on Narcan before each eviction, and we use it in the days before and the weeks after. The trauma of evictions leads to increased overdoses, relapses, and mental health crises. They actively make it more difficult for people to find shelter and support services. Board Bill number 150 provides an alternative system in which resources and community support systems are prioritized rather than systems of violence. It was created via extensive conversations with unhoused individuals, outreachers, and service providers. It listens to those unhoused calls for resources, adequate pathways to housing, and autonomy, and puts these rights into legislation. Tent Mission STL strongly supports Board Bill number 150 because we believe people are more valuable than property. We stand in solidarity with our unhoused family, and we call on this board to do the same. Thank you.
Thank you so much for your testimony. Do any members of the committee have questions or comments? Alderwoman Martin.
I just want to say I appreciate this discussion. I know because I do sit in budget hearings in Jefferson City that there should be more money coming down over the next year. I'm just wondering if anyone can answer on how that plays into it and the ability to fund new projects or new efforts, I should say, or alternative efforts. And it may be too broad of a question.
Are you asking one of the people who provided testimony that question?
I'm just wondering if there's any sort of preparation for that as far as money coming in for the unhoused and some of the alternative, I guess, housing opportunities like the tiny houses or some other efforts out there or ideas.
I guess I can answer quickly. I'm not really sure.
So I guess what I'm thinking is we may have the city may have the ability to do more than it ever has before, and just how your legislation plays into not necessarily doing the same thing as we have in the past, which obviously isn't working, and combined with some new efforts out there.
Sure. So I can definitely answer that question. I know with the ARPA funding, there are a number of applications that have not been funded yet, and some of the decisions have not been made. Some of it's just outstanding contracts that need to be signed, and some of it, the decisions have not been made on the money that the board has already allocated from this past July. And then we have another trough of money that we'll be making decisions upon. And I think it's really great to have Dr. Yusuf Skagen as our new Director of Human Services on board, because he has a much more comprehensive plan that aligns well with entities like the city's continuum of care and organizations that are providing services for the unhoused. The comments from the 2 downtown residents are not lost on me. One of the biggest issues that we have is when encampments need to be disbanded, there really is not a place for some of these people to go. And so that creates a huge problem. A number of individuals were housed at Camp Cole when the Interco Plaza encampment was disbanded. And I think also when you have low barrier shelters, such as the one I know that you were aware that I was helping run at St. Louis University's campus, we had easily 65 people there on a regular basis because we were able to provide shelter for people who were typically banned from other shelters for not following the really restrictive rules that are in place. And because we had a process in place to de-escalate situations where people would typically get kicked out, there was a way to address handling that in a much more thoughtful manner. And so I think we're headed in the right way towards making some much better decisions for our unhoused neighbors alongside the legislation that we're able to pass. But to your point, this is definitely a piece that's important because all we're doing is moving these people from place to place to place. We are not solving the problem. So just simply disbanding an encampment does not solve the issue at all. We need to be much more thoughtful and comprehensive and strategic in our process. And I think those things are being put into place. Is that helpful?
Yeah, no, it is. And I just know, through the state DMH and then some opioid funding, there will just be some opportunities. Hopefully there will be some opportunities for better, I should say, just, I don't know how to put this, but, for some efforts out there that we just had that have been more just ideas in the past, I guess is what I'm saying.
Yep, I totally agree. Thanks for bringing those points up. I think they're incredibly important.
Thank you.
Sure. And Mr. Lindsay, thanks for rejoining us as a panelist. Are you ready to testify?
I am indeed, yes.
Okay, thank you so much for your patience. You have 3 minutes, and if you could just explain to us quickly who you are and the organization that you're representing and then provide testimony, we'd be happy to hear it. Thank you so much.
Okay, thank you much. My name is Robert Lindsay, and I speak here today as a volunteer member of Amnesty International USA. We are a non-governmental organization that advocates for individual human rights worldwide, and I currently serve and speak as Amnesty Missouri's legislative coordinator. I live downtown. I've owned my residence here for 15 years. My home's paid for. I have a more than adequate pension, and as of today, I'm in good health. And while I've done foolish, selfish things over the years that have jeopardized this well-being and had the potential for the dire consequences that we see many of this homeless population experience, I've always had an adequate safety net underneath me. I'm third generation, raised in a healthy 2-parent home. My ancestors, they arrived here, fit into the dominant demographic, and in short, I'm a product of the American dream today. So I've got a lot to be grateful for, but there are many out there, some sleeping just below my loft window at times, that have had the very opposite experience. And it would be selfish indeed for me to repeat the old canards we hear to justify continued refusal to provide these persons with even the bare minimum needed to survive anywhere close to humane standards. I reject the stereotypes. I'm not going to repeat them here. They do nothing more than attempt to absolve us from our responsibility to these people. A lot of factors have led them into homelessness. And indeed, a lot of these people are not capable of independent living. So the talk about permanent supportive housing in many instances is empty. I support Board Bill 150. I think it defines not only it sets forth the nature of the problem, but also a plan of action that would mitigate much of the suffering and provide even the bare minimum of services that a human being in the United States should be able to expect. I get a little emotional about this, but I view this continual moving it's Gestapo-like blitzkriegs to dismantle these settlements and the continued harassment. It just has no place in St. Louis. The notice periods and forbearance provided for in this bill are entirely reasonable, and they don't do any harm to citizens like me who have my entire life savings is vested in this loft downtown. So I've, yes, you could say I have a selfish interest, and I still believe that these people, their interests become primary. There's money been made available through pandemic relief legislation. I think there's money still on the table that could be used. And the ongoing cost of even operating the bare minimum of facilities to bring these people in out of the cold and feed them should be readily available here in St. Louis. And there's organizations in place that can be contracted to do this work. So I urge the committee to advocate for this bill's passage. I also submitted a written statement. I hope you'll have the opportunity to read that. Thank you for the time. Any questions I can answer rather.
Thanks so much for your time and testimony. Do any members of the committee have any questions or comments? All right, thanks again, Mr. Lindsay. Appreciate your patience.
Thank you.
All right, we are moving to Board Bill 84. Do we still have Alderwoman Middlebrook on? Would you be willing to chair the meeting?
Yes, ma'am.
Okay, thank you so much.
All right. I'm sorry, Chairwoman Ingracia, you can go ahead with Board Bill 84.
Thank you so much. Before you is Board Bill 84 today. And with your permission, I have a committee substitute that should be in your folders. I'm hoping to put that before the committee if possible.
I'll make a motion that we hear and discuss Board Bill 84 committee substitute.
Second.
That.
Okay, please move ahead.
Would you like the clerk to call the roll?
Oh, yes, I'm sorry. Madam Clerk, please call the roll.
Alderwoman Green, Alderman Gunther,
Aye.
Alderwoman Martin,
Aye.
Alderwoman Middlebrook,
Aye.
Alderwoman Rice,
Aye.
Alderman Todd, Chairwoman Ingracia.
Aye.
5 aye votes.
Thank you, Madam Clerk. Chairwoman Ingracia, would you like to proceed?
Thank you so much. I am going to turn this over to Craig Schmidt with the Health Department to make sure that I do not mess up the details of the committee substitute that's before us. I apologize. I introduced this board bill back in July and completely lost track of it until he kindly reminded me last week that it still had not been heard. So Craig, if you don't mind taking over, I would appreciate it.
Thank you, Madam Chairwoman and members of the committee. And thanks especially for the committee substitute. It was brought to my attention by our fiscal people and by our director that we had received additional funding through the Missouri Department of Health and Senior Services up to $603,273 for adult vaccinations. As we know, the pandemic is not over, even though we might be altering some of our mitigation attempts, and in fact, the efforts to educate and bring people to options for greater vaccination was brought to our attention again today, and we thank you very much, everyone who's in a leadership role. So this would provide options for that to occur. The vaccination needs are still occurring, and some of those expenses could in fact go up in terms of the educational needs and trying to go into our more vulnerable areas that have the greater need to get out into the community. That's all the testimony I have, Madam Chairwoman and members of the committee.
I'd be happy to take questions, and I think Craig would as well.
Yes.
Alderwoman Middlebrook, I think you're muted.
I am, thank you. Alderwoman Green. Alderman Gunther.
Thank you, Madam Vice Chair. Mr. Schmidt, just looking through here. So the original bill, I guess, was $197,000. So then we've received, the state of Missouri has given us what, an additional $400,000, basically, roughly.
Right, correct, yes, sir.
Okay. All right, that's all. I was just running through here, seeing what our additional funds were. So yes, I absolutely support this. And I think because of the testimony of Dr. Mahdi earlier, this money is going to go far to help us get the populations that are currently unvaccinated or boosted. So fully support this. Thank you very much.
Thank you.
Thank you. Alderwoman Martin.
No questions. I think this is great. Any effort we can make. I think at this point we're in the stage where it's all about vaccination. Thank you.
Thank you. Alderwoman Rice.
Thank you, Madam Vice Chair, and thank you, Mr. Schmidt, for the bill. I'm curious that the document gets a little bit fuzzy when we get into. I'm sure it's just scanned pages, but there's an incentive allowability chart, and I might be reading it wrong. But are the incentives for the health department, or are those incentives that we can be giving out to folks who are looking to get vaccinated?
And I would have to look to make sure that we can do that under this funding, but the incentives are always for the individuals who are looking to get vaccinated, not for us.
Okay. So it's a little bit unreadable. I think it's page 33 of the bill. If we have a chance to maybe get an updated chart out to the committee, I would like that, because I'm curious. We were a year into vaccine availability, a year plus into vaccine availability at this point. And I'm wondering, I know we're still doing multiple vaccination clinics a week. What are the things that we're seeing that are working? Are there other jurisdictions that are having the same challenges that we are, that are finding innovative ways to reach folks? How are we moving the needle here, I guess?
Yeah, so I am not out and doing that, but I do know that there are incentives that are being provided, and I do know that there are individuals, including our director, who are out there constantly trying to make sure that that they are addressing those hesitancies and trying to make sure that it is accessible and available. Yes, there are constant efforts to try to see if there are other ways to try to address it as well. There are legitimate concerns that people have. And so when those opportunities, including those which obviously you have spoken about today and that you are engaged in, whenever it's possible to debunk some of the misinformation that's out there and provide information about what's available, that's always helpful. And yes, those efforts are made. And yes, there are incentives that are available when the Department of Health has these vaccination clinics now, not only for the first dose, but later doses, and I believe some boosters as well.
Yeah, okay, I appreciate that. Go ahead.
Do you mind if I just answer a little bit further on that? I think it's anecdotal, but I just based on my own experience at Clinton Peabody, having the incentives for the first dose was incredibly helpful, especially when we were out knocking on doors and having neighbors telling neighbors about that. And then by the time we were able to have the second vaccine event, I think it was last weekend or the weekend before last, we were able to give incentives to second vaccines and boosters. And that again was a big motivator. And I think that's one of the reasons why the health department expanded to more than just the first dose. And so that is seemingly working well, at least for certain populations in the city.
Sure. Yeah. And it makes a lot of sense, particularly for folks who are on hourly wages, if they're having to take off time from work to get vaccinated or potentially, deal with side effects, to have those incentives in place. So I support that. I'm curious. I just know that we're struggling to increase our population of vaccinated folks. And so, any time that we can we can be innovative, or we can learn best practices from another jurisdiction on what is working well to, to help educate folks and calm their fears, and then get them to those vaccines, or get the vaccines to them, right? We talked about going, door to door. I believe that may have happened with some of our senior populations. If that's something that is still possible, would love to see this program support that, going to where people are instead of making them come out to us. I think Alderwoman Gracia, you saw good results from taking the clinic to the Clinton Peabody complex, and folks are able to get to you more easily there. So yeah, I get a lot of questions from my constituents about, what efforts are we taking? Are they working? What can we be doing better? As we personally have put a lot of money towards vaccination efforts, and the state and the feds have as well. So any way that we can get kind of reports back about events that are more successful than others, or is the health department just gonna pop up all around the summertime and get folks, what I mean? So however we can best communicate that back, that these investments of cash are working to reach our populations that need protection, that would be helpful to communicate. So thank you.
Okay, thank you. And Alderman Todd, have you returned? Okay, and I have no questions. So Alderwoman Ingracia, do you have anything to close with us?
Nothing in closing. I would just appreciate a due pass recommendation for Board Bill 84.
Thank you. Okay, can we get a motion to for due pass recommendation for Board Bill number 84, committee substitute?
I'll move that we pass Board Bill 84 out of committee with the due pass recommendation. And Madam Clerk, I'd also like to add my name as a co-sponsor.
So noted.
I will second that if you call it the committee substitute to Board Bill 84.
84 committee substitute.
Yes, second.
Thank you. I'm sorry, Alderwoman Martin, do you have a question? Your hand is up. I just realized that. Okay, she has no question. Okay. And Madam Clerk, can you please call the roll?
Alderwoman Green. Alderman Gunther.
Aye.
Alderwoman Martin.
Aye.
Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd. Chairwoman Ingracia.
Aye.
5 aye votes.
Okay, thank you. By your vote, we have sustained a motion to pass out Board Bill 84 committee substitute. Thank you.
Thanks so much for taking over for a moment, Alderwoman Middlebrook. Does anyone have any announcements? We have no excused members, so I would entertain a motion to adjourn.
So moved.
Second.
All in favor, signify by saying aye.
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 All right, thanks so much for your time today. I didn't realize it was going to be this long. Take care, everyone.
Thanks.